Khor Wei Boon, and I'm a senior consultant ophthalmologist with the Singapore Eye and Vision Clinic in Paragon. So my specialty is in cornea transplantation, refractive surgery, and of course, cataract surgery. So these are 5 questions that every LASIK surgeon will get asked. Number 1, is LASIK eye surgery? And the answer is yes, LASIK is a form of eye surgery. It involves creating a thin flap on the cornea, lifting it open like a book cover, and reshaping the underlying tissue with a laser before replacing the flap again and letting it heal without the need for sutures. While the process is quick, non-invasive, and done as an outpatient, LASIK still requires very precise surgical techniques, specialized equipment, and very careful planning to ensure good results. And because it is surgery, patients do need to understand the benefits of LASIK and to balance that with the very small risk of side effects and complications. So, question 2, can LASIK treat astigmatism? And the answer is yes, LASIK can treat astigmatism. Astigmatism, like myopia, is a form of refractive error where light rays that enter the eye are not focused properly onto the back of the eye. In fact, LASIK does very well in correcting myopia and astigmatism, and the majority of patients will achieve 6/6 vision after LASIK, meaning they're going to see the smallest line on the vision chart without the need for glasses. Sadly, LASIK does not prevent or reverse presbyopia or 老花, which is the gradual loss of near vision that typically begins in our 40s. So the ability to focus on near objects depends on very tiny muscles in our eyes that adjust the shape of our lens, much like an inbuilt autofocus. And as we age, the lens hardens and the muscles weaken, resulting in this loss of vision. Unfortunately, no surgery, including LASIK, can reverse or prevent this aging process. However, patients with presbyopia may benefit from what we call monovision or blended vision LASIK. In monovision, one eye has full correction of the refractive error, which results in very good distance vision. The other eye is left slightly short-sighted, so that the focal point for that eye is at reading distance. And while it may take some time for patients to get used to this monovision, many patients do benefit and reduce their need for reading glasses. So question 3, is LASIK safe? Again, the answer is yes. LASIK is one of the safest eye surgeries available today, and the majority of patients are going to achieve 6/6 vision at the end of the surgery. However, even as the surgery goes well, some patients may experience temporary side effects such as dry eyes. This is part of the healing process and will typically recover over weeks or months. For an even smaller number of patients, they may experience some night vision issues. For example, lights at night may not appear so focused. They may see halos or starbursts around street lamps or car headlights. This can improve with time, but for some patients, these may be permanent. Finally, as for any surgery, there is always a small risk of complications. And these complications may include serious things like infection or damage to the cornea, which fortunately are very rare when LASIK is performed by an experienced surgeon. To put it into perspective, you are more likely to win first prize in 4D, where the odds are 1 in 10,000, than you are to suffer a serious complication from LASIK. Question 4, is everyone suitable for LASIK? And the answer is no, not everyone is suitable for LASIK. One of the reasons LASIK is so safe is because we undergo a rigorous screening process of every patient to make sure they are suitable. This way, we maximize the chances of achieving very good vision while minimizing the risk of complications and side effects. During this screening, patients will undergo a thorough eye examination and specialized tests to determine the power of the eye, as well as the thickness, the shape, and the overall health of the cornea. While LASIK can correct up to 1,000 degrees of short-sightedness, this very much depends on the health of the cornea and whether it's enough to support such high powers of correction. Question 5, is LASIK the only way to achieve good vision? And the answer is no. While LASIK is the most widely known form of laser vision correction, it's definitely not the only option. For patients who are not suitable for LASIK or have concerns about the use of LASIK, there are excellent alternatives such as lenticule extraction and surface ablation. And both of these surgeries are safe and effective and deliver visual results as good as LASIK. In lenticule extraction, a laser is used to carve out a thin sliver or lenticule of tissue from within the cornea, which is then removed through a keyhole incision. Because the lenticule extraction does not create the flap like LASIK does, it's a good option for patients who play high-impact sports such as rugby or do martial arts, where the risk of a flap displacement may be a concern. Surface ablation, such as trans-PRK, involves reshaping the cornea by applying the laser directly onto the surface without the need for a LASIK flap. This makes surface ablation a good alternative for patients with thinner corneas who are not good candidates for LASIK. And these are the 5 questions that every LASIK doctor gets asked.